let me just put this in perspective. If HIV/AIDS were the leading cause of death of white women between the ages of 25 and 34, there would be an outraged outcry in this country.
In 1990, Congress enacted a law that has been a vital part of our national strategy to fight AIDS and HIV, the Ryan White CARE Act, which directs support and resources to the people and places most in need throughout our nation. It was an incredible act of compassion, smart decision-making, and bipartisanship. Members in this chamber put aside politics, recognized the seriousness of the crisis, and took action. How far we have come. Unfortunately, though, the recent debate around the Ryan White CARE Act has been marred by misconceptions and mired in politics, and it's time to set the record straight. We are having a debate now over a shrinking pot of funding. At a time when I absolutely agree, more and more states have greater and greater needs. But to argue about the formula instead of arguing about the program and what it needs to be funded appropriately seems like a diversion to me. We're having a formula fight, and we should be focused on fixing our strategy and strengthening our funding to meet the growing challenge and crisis of HIV/AIDS in America. That is the real debate we should be having on the floor of the Senate. Here's a chart that shows the increase of people living with HIV/AIDS in the United States. That's this line right here. And it shows the declines in funding for Title I of the CARE Act. So you can see the disparity. I have a great deal of sympathy for my friends from states that are just realizing the full extent of the AIDS crisis in their communities, who are deeply concerned by the fast-growing number of such cases among poor women, among our African American and Hispanic populations. But here's part of the reason why we're in this dilemma. Here's the number of AIDS cases, and here's the amount of funding available to deal with them. Instead of honoring our moral obligation, instead of strengthening our efforts as the epidemic continues to grow, state and local agencies and community groups have been forced to do more with less. With the exception of the AIDS Drug Assistance Program, which still does not go nearly far enough, given the long waiting list for the poorest and the sickest of those who cannot afford the drugs they need to stay healthy and alive, the CARE Act has been cut over the past 3 years, even as costs and the number of people with the virus have risen, adding to the pressure on New Jersey, New York, and other states with higher costs of living and the largest numbers of people living with HIV and AIDS. In addition, the Ryan White CARE Act is the payer of last resort. It's the safety net for the safety net. And this Congress and the administration have spent years trying to cut big holes in both. In fact, the CARE Act is only part of the strategy against this terrible disease. The Medicaid program serves nearly half of those living with HIV and AIDS in America, and this Republican Congress and the Republican administration have tried time and time again to cut Medicaid and have succeeded in passing drastic reductions. I've introduced bipartisan legislation with my colleague, Senator Gordon Smith, the Early Treatment for HIV Act. This legislation would provide federal funding to extend Medicaid eligibility to low-income Americans living with HIV before they develop symptoms, allowing them to access life-extending medical services. And there are those suggesting that somehow the epidemic has changed, trying to pit one part of the country against another, trying once again to divide us. My Republican colleagues have told me there's not enough money to prevent cutbacks for New York and other states that lose under this proposed formula. 9 states plus Puerto Rico lose. Every other state makes gains. So in effect, you want to take money away from my 100,000 people living with HIV/AIDS and give it to worthy people in other parts of the country because this administration and this Congress won't put more money into funding treatment programs for HIV and AIDS. My colleagues on the other side have still refused to provide us with a guarantee at a time when the epidemic continues to grow that New York and the other states facing losses will not lose out. A guarantee meant to make sure that people dying with AIDS have the treatment they need. In fact, the White House and Republican leadership in the Congress are cynically pressuring many of my colleagues that if they don't reauthorize the bill this year, they will face cuts in funding next year. But approving a fundamentally flawed bill under pressure that will end up hurting people living with HIV and AIDS is the wrong thing to do. We should be working to strengthen the CARE Act for everyone. Indeed, the version of the bill my colleagues want to bring up would flat fund what's called Title IV, the very programs designed to address the needs of women, infants, and children, the populations that so many have come to this floor and spoken about eloquently. Well, let's put the money where our mouths are. As we decide to meet the growing AIDS epidemic in our nation, I hope that we can look at the facts about how the program works now and try to come to a bipartisan solution that covers the entire country's needs and leads to a real solution, not a political one. We know there are solutions. Those of us representing the states that are going to be giving up money so money can be shifted to take care of other people who are worthy and deserve help have proposed solutions. And this is not about politics. This is about how we help people. You know, my colleagues from New York, from New Jersey, Illinois, and Florida, we've proposed a one-year extension for the Ryan White CARE Act. So let's then extend it for a year, and then let's figure out how we can fix it. I think we could raise the authorization levels across the titles by 3.7%. Set up a grant program to address unmet needs in states that do not receive Title I funding in order to address the challenge in rural areas where HIV incidence has also increased. I don't think anyone cares more about this legislation. I understand completely the profound importance of the Ryan White CARE Act. I'm committed to the reauthorization of a good bill that strengthens and improves the ability of all Americans to access HIV and AIDS care, support, and treatment. But a bill that destabilizes existing systems of care and devastates, even destroying the ability of high-prevalence communities to address needs is unacceptable. I stand ready to work with my colleagues on a fair, open-minded, nonpartisan, practical solution in the spirit of the original bill that brought people together to develop a strategy to combat this horrible epidemic that has caused so much death and destruction, destroyed so many lives, created such a challenge to our healthcare system and our basic values. Mr. President, we can do this if we really want to. All it takes is to narrow the gap between these two lines, HIV/AIDS cases and the amount of funding available. You know, some of the priorities that we're asked to vote on in this chamber certainly don't reflect the pressing needs that I've heard described on this floor. So, Mr. President, I would hope we could come up with a real solution for the Ryan White CARES Act.
You and I were meant to fly.